Hey guys, so I actually had a little bit of a nursing related rant that I have to just get off my chest. So this happened last night. I was working on the trach unit and it was my second rounds. Basically, when I come in, I check to make sure that everybody is breathing and that they're okay. And usually, I don't have any issue with everybody being dry and clean or anything like that. But last night, I definitely did. And I don't know, I want to say it was the nurse because the CNA that I relieved yesterday, she never leaves patients like this for me, like ever. And like maybe a half an hour before this happened, the nurse had gone in there to like check on the feed and suction her, this patient. So I want to say that it was the nurse, but I'm not sure exactly who it was. So anyway, what happened was I go in to do my second rounds. So this was about midnight. Because my shift starts at 10, and like I said, I check everybody at 10 to make sure that everybody's breathing, everybody's beds are as low as they can be, everybody's comfortable, nobody needs anything, and then I do my second rounds at midnight. So when I go in there, I actually started my second rounds with this person. Um, because I like to go in order of the rooms so then I know that I didn't miss anybody. And this person, there's two independent people in the rooms right before hers. So I got to her and I just like her when I walked into her room just smelled off. You know, if you're a CNA or a nurse, you know when something just doesn't smell right. And when I went into the room, like as soon as I walked in the doorway, I knew something was off. She was either wet or, something. So I look at her and her gown, like right up here on her chest area, just looks wet. So I didn't know if it was like mucus, because if you've worked with trach patients before, you know that they tend to have a lot of mucus from the trach area. So that's why I thought it was like mucus from the trach area, because it's like up here on her chest. So I went to go get her a new gown and a new sheet because her sheet was pulled up to about here. So her sheet was wet too. And then when I pull the sheet back, I noticed that it's like the color on the sheet is like brown. So I'm like, I know she didn't have a bowel movement all the way up here. And she didn't. It was feeding tube formula. This is why I think it's the nurse. Because, like I said, she had just been in there checking on her feeding tube and starting a new bottle of feeding tube formula. And the CNA that I relieved, she always checks the feeding tubes to make sure that they're closed, that the little cap is on. When I got in the room and I looked at her feeding tube, the cap was completely off. Like, feeding tube formula was going everywhere. It was just disgusting. And if you have ever worked with feeding tube formula and it's gotten everywhere, you know that it does not smell good. So I had to end up doing like an entire complete bed change because it had gotten on her pillowcase, it had gotten on her gown, it had gotten on her brief, it had gotten on the chucks underneath, it had gotten on the sheet. She didn't have a blanket, but she had like a positioning pillow, and I also had to wipe down the positioning pillow and the mattress because they were soaked. So my thing is, if you notice something like that, don't just let it keep happening. Tell me. like, or tell whatever CNA you're working with, because that is screwed up for me to have to go in. Like, if she would have told me when this first happened, this would have never happened. I would not have had to change her whole bed because, well, I mean, possibly, but chances are I wouldn't have had to change her entire bed because if you catch it early, it doesn't get everywhere. But because it wasn't caught early, which I can't believe that the nurse didn't know that it was open, because she's done this before. And that's another reason why I think it's the nurse that did it and not the CNA. Because this nurse was hired at the same time as me, and we've worked together on the trach unit in the past, and she has done this multiple times in the past. And then she'll tell me, usually, she'll tell me like maybe 20 minutes later, a half an hour later, she'll tell me, you know, hey, can you go change so-and-so? There's feeding tube formula everywhere. She never takes responsibility for it, but she at least tells me. And this time she didn't, but you could very clearly see it because I know she checks like the area where the feeding tubes are, like on their body. I know she checks that to make sure there's no drainage and all that stuff. And I know that before she even starts the feed with the new feed bottle, that she checks all of that, and she's supposed to make sure that the cap is on and closed. But apparently she didn't. And it's just frustrating, you know, to have this happen, because I don't think it's fair. I wouldn't do that to my nurse. I wouldn't do that to any CNA coming after me. So why would you do it to me? You know, and I can't say for sure that it was done intentionally, but it just sucks to have to go and change someone, and to know that she was sitting there for probably that 30, 45 minutes before the nurse, or well, she didn't even tell me, you know, after the nurse had come in there and changed the feed bag, to know that she had been sitting there with this feeding tube formula all over her. Like, I ended up having to give her a full bed bath because I didn't want her to smell like feeding tube formula the next morning. So that's pretty much all I have to share. If you are a nurse or a CNA and you notice that the feeding tube cap comes off, put the cap back on, wipe it up, or let me know. Don't just leave it there. Let somebody know. Let that person's CNA know. Let the nurse know, hey, the cap came off and, you know, she needs to be cleaned up. It's not that big of a deal. But it's annoying when you have a patient or a resident who is sitting in feeding tube formula just getting soaked because of the feeding tube formula. It's not that hard, guys. But anyways, that's the end of my rant. If you guys can relate, let me know. If you'd like to hear more stories about what happens while I'm at work, or if you'd like more work-related vlogs, let me know. And I will do them whenever I'm able to, or whenever I have something to share with you guys. So with that being said, that's all I have for right now. I hope you guys are having a great day, and I will talk to you guys again soon.